My name is Isabel Becerra, and access to healthcare is very important to me, and it has been for a very long time.
This is Isabella Becerra. She's from the...
Meeting Jackson was a powerful reminder that everyone deserves access to healthcare services.
When we got his diagnosis, we were very scared because there's so little about what he has.
My role at CIBD, which is the Center for Inherited Blood Disorders.
What grade are you in, Jackson?
It's TK, which, yes.
We serve a community that is uninsured or underinsured.
He's a trooper. He's been through a lot since he's been born.
We see all patients, children, and adults with any form of blood disorder.
They've all really just been truly amazing. We're really fortunate.
I was raised in Orange County, and after college, my first job was as a psych social worker at a migrant farm worker health center in the middle of nowhere in Mount Vernon, Washington. That was my introduction to the community health center movement, and it changed my life. Today, I am the president and CEO of the Coalition of Orange County Community Health Centers, which was formed 45 years ago in response to the needs of the community clinics that were being formed at that time. Community health centers began with a demonstration project under President Lyndon B. Johnson's War on Poverty. This was an effort to bring comprehensive primary care to Black and brown communities. Fast forward to 2010, the Affordable Care Act is signed into law by President Obama, and reports began to appear that predicted that community health centers like CMAR, where I started, would no longer be needed because patients would have choice. But instead, they grew bigger and expanded across the country. In Orange County, community health centers began achieving FQHC status at an impressive rate. In the past 10 years, 65% of our member health centers are FQHCs, and collectively, they all provide over 1 million visits to over 400,000 patients annually. One of the pioneers of this movement in California is Castelo de la Rocha, President and CEO of Ultimate Health Services, and a member of our coalition.
I finished my studies at Berkeley Law School, and I thought I wanted to get back to Los Angeles, to my roots, if I may. I found my way to a small clinic at that point called La Clínica Familiar del Barrio. That free clinic was incorporated in 1969, but I became the president and CEO of La Clínica Familiar in 1977. Here I am 42 years later, and I'm still president and CEO of the same organization. We discovered as part of this process that we had a national problem. The problem with uninsured was a national issue. We saw it in Orange County, and at some point down the line, we made a decision to make an entry into Orange County and to be part of the delivery system of the community clinics for uninsured populations.
Community health centers provide culturally competent, comprehensive, and affordable health care to all communities.
The community clinics really, for lack of a better way to say it, they kind of get it.
The clinics are also the main strategy for addressing things that go beyond healthcare needs.
Community Health Center is nonprofit. It is driven by a board, governed by a board that is over half patients.
In some cases, we'll have those families, not for months, not for years, but decades.
Its focus is on an integrated whole person practice, and so in that way, it's completely different from a private practice.
The coalition now represents over 70 locations across Orange County.
Orange County, like a lot of communities across the United States, has had a literal epidemic and explosion in chronic disease over the last 2 decades. So things like diabetes, which many people are familiar with, unfortunately.
The condition we're seeing most is what I call Groundhog Day, where you see the same hypertension, cholesterol, type 2 diabetes, and the weight, and then the psychiatric issues that come with that, and then the knee pains and back pains that come with that.
Opiate addictions, diabetes rampant in our community.
You see it repeatedly, over and over again, where it's almost, you can put it in a folder as one diagnosis called the metabolic situation.
Community clinics are well positioned to help patients with chronic issues because we can help them manage their conditions.
The coalition responds to social determinants of health needs with innovative projects.
I couldn't give the patients the resources that they needed. The next patient was waiting for me.
The Live Healthy OC program was meant to provide knowledge and skills to our clinics and our staff.
Well, the population that I serve are folks that have substance use disorders and then everything else that comes in life.
Oh my goodness, how am I gonna make sure everybody's okay, in this 15-minute window? And this void came through with undergraduate students that were asking us if we had any possible rotations or if we had anything going on in our clinics.
It was meant to assist clinics to begin the difficult process of beginning to transform their model of care from a solely disease-focused model.
But now it's front and center and people are overdosing and dying.
So we're like, oh my goodness, let's put everything together. Please come and help us, and we will train you to actually not only see the patients, not only help with patient care, but we'll actually train you to that next generation.
You look at the physical, the spiritual, the psychological, you look at all aspects of things to be able to take care of somebody.
Next year will be our first student graduating from residency going into the workforce.
To one that also now includes prevention, wellness.
Hopefully a little more difficult to be as stigmatizing, because now you get to identify, oh yeah, that is my family and my friends and my pastor and my teacher, and any one of them could have the disease of addiction.
Our practitioners in the examination rooms have an opportunity to learn about the families that they're dealing with.
With the current political situation, those fears might be a little more enhanced or heightened for a lot of our families.
To ask questions about their environment, about their family.
My first patients are already coming in with their own kids, which it makes it beautiful.
Through those encounters that we have, we learn about community needs, voting, rent control, violence, the lack of parks.
For me, the coalition has always been the entity that unites all the federally qualified health centers together.
The coalition is a place where we learn, where we share information, where we receive information.
It's kind of a zocalo, so that means kind of a marketplace. It's a central meeting place.
Coalition has expertise among its members to be able to provide education at the base level and on up.
Share best practices, share ideas, learn about grants and opportunities that can benefit all of them.
We advocate together, we receive policy alerts, and we share best practices.
I am very proud of the coalition. All the community clinics feel that we're working together.
Our clinics are much better able to take care of patients and take care of our providers because of the coalition.
We've been at this location for 26 years in Santa Ana, and let's go ahead and give you a tour of the clinic.
Let me give you the tour.
Dr. Nugent originally was seeing most of her patients at Chalk Children's Hospital, and most of her patients were doing a lot better, having a lot better outcomes.
8 exam rooms, 4 physicians, 3 nurse practitioners.
We have 15 exam rooms.
She saw the need to start an adult clinic right across the street, so it made for an easy transition from pediatric to adult care.
We're within the community of Santa Ana, we're walkable for a lot of our families.
Cerca de aquí, es conveniente este lugar para mí.
Just strengthening the core muscles, and when a patient comes in, they typically see about 7 different providers.
And we're on pace to do 32,000 visits this year. Yay!
This unit has just been delivered to us about 2 to 3 hours ago. Families together is very excited to be able to take this out to the community.
The idea really is to have some sort of a seamless point of interaction so that any person from the county that has a need, that anywhere they hit along the line of that safety net, that it's sticky, that it holds on to them, and then it shepherds them to the place that they need to go, regardless of all the bureaucracy that we currently have in our health system.
Based on my experience, I knew that these predictions were wrong. These places are special and filled with great people, changing lives every single day.